Okay, so we will be ready in a few minutes or a few seconds. Yeah, thank you very much. Okay, so then let's go through it. So this is a quite provocative title, but I will try to explain to you what I mean with a sick healthcare system. Is it this the right one? Yeah. This one. The pointer, yeah, and this one is to go. Oh, I can use this one. Okay, this is my the IT Science Center where I work for, and as I said, I'm working for the EMEA and also the FME working groups, and I would like to address this slide. It shows a more or less idealistic view of a healthcare system. So healthcare is quite special, and it's very complex. And in this slide, you see that at the center of a healthcare system, there is collaboration, information exchange, knowledge management, and process integration. And all these different areas like research, teaching, the healthcare delivery, and the wellness of the people should interact together and collaborate in a collaborative way, and information has to be exchanged. But this is, of course, not the situation that we are facing in our healthcare systems. Our healthcare systems are very fragmented, and there are silos of data, like even in a hospital. Between the different sectors, there is sometimes no good way to exchange the information. Most of the hospitals even use a paper-based approach, even now in the age of ICT. And this is definitely a major challenge. And if you look at the complete healthcare system, you have also the ambulatory, the like home care, and the general practitioners and physicians, the specialists. They are all not really integrated into a one system. So, what I already said, the health IT market is very fragmented, and it's quite difficult to share medical information and integrate these different systems. It's also difficult to measure the efficacy of a health policy and the IT investment. We have very different stakeholders with traditional roles, like physicians, nurses, health insurances, pharmacists, and so on. And in general, you can say that the affinity of these users to IT is not very high. They're not very technical people or IT people or people that are use IT naturally. And so also we have noticed that some modern IT solutions may also clash with the traditional workflow. So the IT companies have not really solved the problem to adapt their solutions to the real needs, to the workflows of the medical people. And IT in healthcare is a moving target, because research is very fast, and of course the healthcare providers and the physicians try to adapt to the newest of research. There is a continuous need for adaptation of these systems, and this is quite a big challenge. Yes, some financial painful experience shows that there is a huge investment of money to cope with these challenges. In Canada, the Health Infoway have spent some 1.5 billion Canadian dollars, and the UK healthcare system is spending tens of billions to to build up a national system that integrates all the different stakeholders. And also in the US, they're facing major investments in this area. But generally, we can say that the traditional healthcare IT has failed to provide adaptable, interoperable, high-quality systems at a reasonable price. And that is the main reason. What I see is that there is not a sufficient collaboration between the different providers of these systems. Even we have standards, this is not sufficient. So when we come to the area of loss in healthcare, we also notice that floss in healthcare lags behind the general floss movement or other industries. And why is this so? So I think the main reason is that in healthcare, the developers are not the users of their solutions. Like if you go and program like a browser, then the software developer is also the domain specialist. He knows what a browser should do. And in general speaking, in healthcare, this is not the case. The programmers are not medical people, they are not physicians, and they normally do not know what a radiologist or a cardiologist specifically needs. So there's definitely, you have to bring together two different worlds, the health professionals and the IT specialists, and this is a real challenge. And as I said, the market is highly specialized, and it needs expertise to do this software programming. It's not something that you can do at home in your spare time. So if we look at floss in healthcare, you can look at it in two ways. In an optimistic way, you have a glass half full. You have the openness, transparency, collaboration, and all the good things that we have from the floss philosophy. And I would also point out some of the major reasons, I think, to apply this methodology is, from my point of view, the prevention of vendor lock-in and the control over the software. I mean, also the lower TCO, but I think some of the main motivations is also to have control over the software, because from the vendor point of view, they would like to sell you a commodity, something that fits all sizes in a way. And in healthcare, this is definitely not the case. Even from one hospital to another hospital, of course, you have a lot of commonalities, but you also have a kind of different way how to cope with workflows, for instance. So there is, in every hospital, there is the need for adaptation of these systems, and this is usually something that IT providers do not like very much. They want to sell one application or one solution to as many customers as possible. And if you would like to have an adaptation, you have to go to the provider or to the vendor and say, okay, I would like to have this adaptation. And they say, okay, 100,000 euros or dollars, I can do it for you. And often, of course, the hospitals cannot do this. And so they are somehow locked into this situation. Of course, we also have barriers for floss in healthcare. And I think one of the main barriers is the lack of professional support. Because if you're working in a hospital, you just have to, the system has to run. And the IT responsibles, they cannot just look at or go the risk of trying out other solutions, and the risk is simply too high for them, and they have to have this professional support services they cannot rely on a community. And of course there are also quality concerns and sustainability concerns, and as I said, there is no one to sue in case of problems. mainly the IT responsibles, they would like to have someone to call in case of problems.